thank you. We are here with Jonas Johnson, who is the professor and Eugene Myers Chair of the Department of Otolaryngology here at the University of Pittsburgh School of Medicine. And the American Head and Neck Society is hosting this. We just would like to talk to some of the leaders in head and neck surgery. And so we're so glad. Thank you so much, Dr. Johnson, for talking to us today. We're just really, we know you have had such a wonderful career. We kind of want to get back to the beginning and find out what made you decide to go into medicine in the first place.
So I think my story is not terribly different than many people. I was undifferentiated, except to say that I was interested in science. I was interested in life science. So I seriously considered dentistry because my father's a dentist. I considered being a veterinarian because I always liked animals and I thought that would be cool. Mm-hmm. But when I actually started to look into it looked to me like the investment to go into medicine was pretty similar, and the payoff for the, what you'd end up with was more valuable. So that pretty much caused me to decide to pursue a career in medicine.
And then once you got to medical school, how did you choose otolaryngology?
So again, I was undifferentiated. When I got to med school, the requirement was you had to pick a mentor. And I chose a man named George Reed. So it turns out that George Reed was one of the iconic leaders in head and neck surgery at the time. George was doing all kinds of big head and neck surgery. He was training residents to do it. And actually, one of his funniest stories was George claimed that as a fellow, he was the first otolaryngologist ever to do a neck dissection in Boston. Oh. And he said, frankly, his attending was afraid to come in the room because of the clash, over turf. Mm-hmm. But at any rate, George was bigger than life. It was easy to follow him around, watch him. And I sort of was swept up in the whole thing.
And then how did you decide to, how did you choose your residency? Was it a match process? Or?
So there was no match in my day. Actually, it was curious, but what I experienced was that I visited several programs, and each time I was offered a job. But each time I was offered a job with something like, let me know in 24 hours. And it really put you in a corner because you either had, it was like, would you, bird in the hand, mm-hmm. Would you take the one in the hand or you wait till you get to the next one? Well, at the time, I really wanted to look around. And the other thing is that I was pretty sure that Dr. Reed would take me in his program if I held off. So that's exactly what I did. And I ended up training at George Reed's program.
And then, so I guess my next question was about a mentor in your life. What about, did you continue to work with him when you were a resident?
So the bad news is that shortly after I became a resident, Dr. Reed became the president of the medical center and was kind of promoted mm-hmm. out of the clinical arena. But I was very lucky. The people I remember and relate most with as being my mentors was first a man named Harvey Tucker. And Dr. Tucker eventually became the chair at the Cleveland Clinic. Mm-hmm. The other one was Charles Cummings, who was with me as a resident. And then he became chair first in Seattle and eventually in Johns Hopkins. Mm-hmm. And then, I had an obligation to the Air Force. So I did 2 years in the Air Force and I went to Pittsburgh. And the third person who was a mentor to me to this day, actually, is Eugene Myers. So I think we all rely on mentors and role models, and I've been lucky. I've had a few.
Yes, those are some big names. Tell me a funny story or an important story about one of your mentors.
Well, a funny story. When Harvey Tucker was leaving Syracuse, Dr. Reed was recruiting Charles Cummings. So Dr. Cummings at the time was in Massachusetts, and he came down to do a visit. And as a resident, I was assigned to take Dr. Cummings for coffee. So we went for coffee, and of course we have our coffee, and I'm standing in line, and I'm ready to pay. And he says, "You can't pay." I said, "Well, it's my assignment. I'm supposed to take you for coffee." He said, "No, no, no. Residents don't have money," which is pretty true.
Oh, that was very kind of him. I could see him doing that. And then once you got into residency, was head and neck surgery one of the choices, or did you kind of carve out your own way to do head and neck surgery?
So, I think it's fair to say that I liked almost everything.
Mm-hmm.
I enjoyed being a doctor. I enjoyed being a surgeon. But as things evolved, I became more and more interested in head and neck. Um, when I went into the Air Force, I was doing everything. I mean, the Air Force is a curious place where you can do as many rhinoplasties as you want to do. And so we were doing a little of everything. When I moved to Pittsburgh, of course, Gene Myers was building a head and neck program. And it was my first opportunity to really differentiate. We had an otologist. And so it was pretty easy to say, well, I'm just not going to do otology anymore. And then over the course of time, we hired somebody who's intended to be a rhinologist. It was actually Dr. B.J. Ferguson. Mm-hmm. So I just said, well, I won't do rhinology anymore. And then we hired a voice person who happened to be Dr. Clark Rosen. Mm-hmm. And I said, well, I won't do voice anymore. So that's how we built the program. But what it did was it allowed me to be increasingly committed to just head and neck.
And how would you say, what was important in the field of head and neck surgery around the time when you really identified yourself as a head and neck surgeon?
So, Melonie, things have changed so much. I mean, they've changed so much. Mm-hmm. I remember as a young surgeon wishfully thinking that we were going to figure out how to cure cancer. Mm-hmm. Back in the day, there were all kinds of clinical trials using chemo prevention, reputedly to prevent the development of cancer. And, most of these things just never came to fruition. Yeah. But what was exciting was the opportunity to help people. What was exciting was the opportunity to use all this modern technology in the operating room. And of course, it's changed and changed again. Mm-hmm. And in many ways, it's the best part of my career, is it's never been stagnant. I kid our residents that half of everything we know is wrong, and we just don't know which half it is. I mean, that's really true, I believe. And it's been true over the course of my life. Almost everything that we use clinically today, I learned in the last 5 years. I mean, anatomy doesn't change. Right. But, like almost everything else does. Think about it. The technology with the robotics and the imaging and the drugs with immunotherapeutics. Everything changes all the time. So that's been so exciting. And it's such a challenge to remain competent.
Right. Would you say you had any setbacks in your career, or what did you do to kind of get over those situations?
So, everybody has bad things happen. For me, the biggest setbacks were clinical disappointments. And we would do things and they wouldn't work out the way we wanted to. I mean, it's so disappointing to try to cure a patient with cancer and fail. Mm-hmm. But it happens. And so I became kind of a disciple of a book written by a guy named Charles Bosch, which is titled Forgive and Remember. Mm-hmm. And he challenged us to forgive yourself when things go badly, but to learn something from it and remember. Forgive and remember. Mm-hmm. So for me, this has been a guiding light. Heaven knows we make mistakes all the time. I make mistakes in my domestic life. And, missing an important recital by one of my children. And what you got to do is say, well, I wish I hadn't missed that. And I'm going to forgive myself, but I'm going to remember and it won't happen again. So that is the kind of the way I've tried to steer the boat.
Yeah, that's good advice. You kind of mentioned that things change all the time in our field, which is certainly true. But what about some of the things that are constant? What do you think is kind of something that's just been true throughout your career?
So here we are, and doctors all around me are telling us they feel stressed. They're telling us that what they really don't like is all the changes. And I recognize that it's difficult to change. I think it's true that, generally speaking, the most successful people have the most difficulty changing because they've had success and they want to continue to do it the same way. Mm-hmm. But the world won't allow that. It's just not the way it goes. So I think another guiding principle for all young surgeons should be that we are privileged to be able to take care of people. The care we provide is not available through any other means. So I am very bullish on surgery and on otolaryngology. I think we will be cherished by the community. We will be added value to the healthcare system. And we just have to, maintain the straight and narrow. Don't let the other things get in your way.
Mm-hmm. As you've come through your career, what is the contribution that you've felt that was most impactful to head and neck surgery? You've been involved in so many trials and so many papers.
So once again, as a young guy, I enjoyed a decade during which we did randomized clinical trials, asking questions about antibiotic prophylaxis. Mm-hmm. I enjoyed a decade when we we developed a very sensitive tumor registry, and we had a great deal of opportunities to study our patients and make reports about the efficacy of elective neck dissection, to make reports about the importance of extranodal spread of tumor, to make observations about clinical things. Mm-hmm. So I enjoyed those opportunities. I have to tell you that today I'm building a survivorship program mm-hmm. for head and neck cancer. I'm doing this because I've recognized that there's a great need. Because when we treat a patient for throat cancer, they are never the same again. And so we've come to call this a treatment-related toxicity. Mm-hmm. And you understand what I'm talking about. Sometimes it's xerostomia. Sometimes it's dental loss. Sometimes it's dysphagia or fibrosis. Heavens, it's all these things. So I think that as a community of head and neck oncologists, we've overlooked this mm-hmm. for 40 years. I'm trying to shine a light on it. I do not want people to think I've repudiated surgery. I have not. But what I've done is change my focus and trying to reinvent my own career at this stage in a way that'll impact patients and I hope influence other doctors.
So you really kind of just begun this survivorship work. Where do you think it's going to go, for example, in 5 or 10 years? What would be your goal for survivorship care?
So the mantra of 21st century medicine is to try to shift the focus from volume to value. Mm-hmm. So the volume focus is pretty easy to understand. Everybody is paid measured by RVUs. It's this kind of eat what you kill mentality. And they're asking us to change our mentality. So I'm going to suggest that taking better care of patients, the identifying and preventing or treating toxicities is value. So if we want to get away from just crunching numbers and start to do a better job of taking care of patients, then we'll all embrace this as an opportunity to do enhanced care.
Well, that's pretty much answered my next question about the biggest opportunity. I think that can be translated across the board for head and neck cancer care. What do you think is going to be, in addition to survivorship care, what are the new things in head and neck surgery that are going to continue on, be useful?
So, I've already spoken about my perspective on surgery. I'm very bullish. I think it's a wonderful field. It has great value, and it will always have great value. My hope, my desire as a young man that the medical oncologist would put us out of business is folly. It isn't happening,
Right.
We still need to be at the table, and we still need to help. So I think that the evolution of modern technology is incredible. So I was one of the ones who kind of wondered how we're going to possibly make this robot into an added value. But for me, Melonie, the aha moment was when I saw the two-headed robot.
Mm-hmm.
Because all of a sudden I said, well, there is telesurgery.
Mm-hmm.
This means that we could have two doctors in two cities operating on one patient. And you see, this would allow us to solve a couple of problems that we have in healthcare today. Head and neck is relatively an orphan among cancers. And there's only a few people who know how to do it well.
Mm-hmm.
So how do you serve people in rural communities or in small communities? And the answer may be to keep them at home, but to provide such things, high-end things as a surgical intervention using teletechnology. I think it's coming. I'll bet it comes before you guess.
Yeah. Well, finally, what are some words of wisdom that you have for young head and neck surgeons who are watching this, or people who are thinking about doing head and neck surgery?
So again, this business about being assigned words of wisdom is difficult. At the same time, I believe this is a wonderful field, but I also believe that it changes rapidly. So my word of wisdom to everybody is you must keep up. You must remain contemporary with the equipment we're using, contemporary with the drugs, with the measuring tools like the scans and the images. It's going to change and change again. So frankly, my formula for remaining contemporary is you have to read.
Mm-hmm.
And honestly, I try to read 5 days a week my whole life. Now, I don't read for 3 hours. I read for 30 minutes, but I read almost every day. Number two is you have to go to meetings, because it's at meetings you hear about the new things.
Mm-hmm.
And of course, it's also at meetings where you get to talk to your peers, because then you can balance the new things and you can ask people, have you tried this? And does it work? And is it as good as they say? So it's these three modalities, the reading, the listening, and then the active interchange that allows us to keep up with changes in medicine.
Well, thank you very much, Dr. Johnson, for this interview and for taking time to talk to us. We really value all the things, your experience and your words of wisdom. So thank you very much from American Head and Neck Society.
Thank you, Mel.